Josh. I'm a pharmacist with pharmacisttips.com. Today I'm going to tell you a little bit about Medicare Part D open enrollment and why it's worth a little bit of your time to find the best coverage. You could save yourself a lot of headaches and a lot of money over the upcoming year with just a little bit of time. What is open enrollment? Basically, that's an opportunity for you to change your plan for the next year with Medicare, and you have the potential to reduce your costs for for your medications or your monthly premiums. And I see this happen a lot. Do not assume your plan is going to be the same for the following year. I've seen many people say, "Oh, well, I'm happy with my plan. I'm happy with what they cover." And then they find out the next year their pharmacy is no longer preferred, their medication may not be covered, they've changed the coverage. So just a little bit of time could save you significantly, not only money, but time and headaches and issues with medications not being covered after the first. Medicare plans for the 2019, the open enrollment is 2018, October 15th through December 7th. Most of the plans for 2019 are going to have a $415 deductible, meaning you pay out of pocket the first $415 of your medications. Coverage gap is reached, or the donut hole is commonly known as, at 3,820. And then catastrophic coverage, that's when they cover almost everything, is after you spend a little over $5,000. And that's for the 2019. Some considerations that you should, when you're planning for the new year, you don't just want to look at your monthly premium. A lot of people pick the one with the cheapest premium. Well, then they end up paying huge copays or the medicines aren't covered. So you want to look at it all together. You got to consider your copays. You got to consider the monthly premium. You want to make sure that your medications are covered. You want to make sure that the pharmacy you prefer is covered. And then you could consider the star rating as well. Star rating is basically how well the plan is rated by people who have had the plan. So how do you check to make sure your plan is the best? Well, you can go to Medicare.gov. I'm going to walk you through that process here in a moment, or you can call 1-800-Medicare. And they can walk you through that. Many of your local insurance agents can. They may not have all plans available, so it may not be a full picture, but they can usually give you a pretty good idea, find you a good plan. Many communities offer assistance, different programs and things. You can check at the doctor's office, at the pharmacy, if they're aware of any local programs to help you run through your medications, make sure that the coming year your coverage will be what you're expecting. I'm just going to walk you through. If you go to Medicare.gov, this is what you're going to come to, and you're just going to check out finding health and drug plans. And then well, I did the basic search here where you put in your zip code and then you click find plans. And then it's going to ask you to enter information. You can um, you can even put, I don't know what coverage I have, and it's also going to ask if you qualify for extra help. So if your income is low enough to qualify for extra help, that is something you can add as well. On this example, I put I do not get any extra help, and then I did put that I want to add the drugs. And then you click continue to plan results. It'll bring up the opportunity to enter in your medications, the dosage, and the quantity that you get per month. So after that, I just picked 3 random drugs here. I put in Januvia, lansoprazole, and paroxetine, just to kind of have a mix of the 2 of them are generic and the one is brand name. Go on, step 3 or 4, it'll bring you up a list of local pharmacies. You can go through and click the pharmacies that you would like to have available on this plan. On, and then it brings up this option. I picked prescription drug plans that showed me how many were available. It also showed that there were some available without drug coverage. Well, that's not something I want. So I checked this box and continue to plan results. And here it brings up, these are like the top 3. So if we look, here's our monthly premium, and look, the number 2 one is a cheaper premium, but the overall cost is $300 more a year. So there's your annual cost. So the one with a higher premium actually would cost me less throughout the year. I'd save $300. Whereas that monthly premium's lower, but in the long run, it's going to cost me more. And see, like here's an $80 premium, and we're looking at $3,700 annual cost, so about the same as that one. So you really want to take that into consideration. All of these are 3.5, well, about three out of 5 stars rating. Um, what we can do, actually, what I did there is I clicked on the compare plans, and so it's going to bring up the top 2 plans here. And again, there we can see our premiums, the costs at different pharmacies of the 2 different plans. You can enroll directly by calling the plan here with this number if you want to, but it's nice that you can bring up this comparison. And here it shows our monthly cost on these plans, and we're going to reach the donut hole or the coverage gap in the 9th month. And so it shows our out-of-pocket cost is going to go up about about $70 on the one, and about $50 over here because we have that brand name medication Januvia, and those usually, typically, when you're taking a more expensive brand name, you're going to reach that coverage gap. You also want to notice here, January we had a deductible, so our cost in January is $650 out of pocket, whereas the one without the deductible, our cost is pretty consistent till we hit the donut hole. So those are really things you want to consider, especially if you're on a fixed budget and you don't have extra cash to drop down in January to meet that deductible. You really want to consider that when plans. And here again, this is on the comparison chart, comparing the 2 plans, and it's showing that Januvia, that's a brand name medication, is on the tier 3. It's preferred by the plans, but it costs more. Tier 3 means it's covered, but your copay is going to be higher than generic. So you really can save yourself money. The Medicare website is really helpful. It's really easy to use. If you can't use it yourself, you can sure see if somebody can help you or find local programs. But again, that's Medicare.gov, or you can call Medicare. And be sure you do it before open enrollment ends. It could work out really well for you. Thanks for watching the video. I do hope you appreciate the information that I provided, and I'd love it if you'd subscribe to my channel. Thanks again.